Hypotension means low blood pressure. That is when your blood pressure is below the normal. You are welcome to this channel once again. I'm Dr. Ayobola Ogunbanjo, aka Dr. Ayo Cares. So let's talk about low blood pressure, the causes, and some of the signs you could notice. So, what is the normal blood pressure? First of all, the normal blood pressure is between 90 over 60 millimeter of mercury to 120 over 80 millimeter of mercury. So, any blood pressure below 90 over 60 millimeter of mercury is considered as low, and this could be mild or have life-threatening consequences. Before we continue, kindly subscribe, like, and share this video to reach more people. So let's get to it. Low blood pressure could happen due to some of these following reasons. Number one, dehydration. Dehydration could result from diarrhea. When you have lost a lot of fluid from diarrhea, your body gets dehydrated, and before you know it, your blood pressure drops. Or from not drinking enough water, you could also have dehydration. Number two, blood loss. Blood loss could cause low blood pressure because your blood volume drops, and this causes your blood pressure to also drop. Blood loss could be as a result of trauma, road traffic accident, or some other reasons. Number three, it could be from internal bleeding, for instance, from a stomach ulcer perforation. Number four, severe infections like sepsis, for instance, could result in low blood pressure. Number five, excessive alcohol intake is another reason your blood pressure could drop. Number six, certain medications like the ones used to treat high blood pressure will cause your blood pressure to drop. Number seven, strenuous exercises could sometimes cause your blood pressure to drop. And number eight, allergic reactions. Some people have adverse reactions to drugs, and this could result in low blood pressure. Also, it could be due to certain heart problems, like certain heart valve problems could cause low blood pressure. What happens is this: when your blood pressure drops, this affects the normal functioning of your heart, and oxygen is not able to reach vital organs like the lungs, the heart, the brain, and all of that. And before you know it, it could result in life-threatening conditions. Therefore, you need to know some of the symptoms of low blood pressure so that you'll be able to take actions in time. So, here are some of the symptoms. Number one, dizziness. That's why it's advisable you have the blood pressure monitoring machine at home so you could check your blood pressure. So when you notice you're feeling dizzy, you could check your blood pressure. That could be the culprit. Number two, headaches. Number three, nausea and vomiting. Number four, blurriness of your vision. You just notice that you could not see very well, everything becomes blurry. It could be a sign that your blood pressure is low. Number five, weakness or fatigue. And then, in life-threatening situations, you could have coma or loss of consciousness. You could have agitation, confusion, altered mental state. And then at that stage, the person needs to be in the hospital under the care of professionals. So before it gets to that stage, make sure with your blood pressure monitoring device at home, check your blood pressure. When you notice any of these early symptoms like dizziness, nausea and vomiting, blurring of vision, check it. If you have low blood pressure, you could drink water. You could take a little bit of salt. If all these don't work, visit your doctors immediately. Or if you notice you have persistent low blood pressure, despite any measure you take, I think it's high time you see your doctors immediately. Low blood pressure should be properly monitored and managed to prevent life-threatening consequences. Meanwhile, here are some of the ways you could prevent it. Stay hydrated. Take a lot of fluids, especially water. Limit alcohol consumption. Alcohol could be dehydrating, and this could cause you to have low blood pressure. Number three, if you have infections, go to the necessary professionals, get well tested and treated to prevent the infection from becoming severe or complicated, so much so that it will now cause low blood pressure, which could be life-threatening. Number four, speak to your doctors about any medications you're taking that could be causing your blood pressure to drop. And number five, if sometimes there's something we call orthostatic hypotension, So when you have that, don't get up too quickly from your bed. Don't get up too quickly from a lying position to a standing position. Take your time to get up. And if you are somebody that doesn't take salt, and that could be the reason for your low blood pressure, you could speak to your doctors maybe about adding salt, a little bit of salt to your diet. And there are times when you are not able to prevent low blood pressure because the situation is out of hand, like in the case of road traffic accidents, internal bleeding, or severe infection. At such times, a professional should be consulted to properly manage the low blood pressure. So I'll be stopping here for today. Kindly drop your comments in the comment section, ask your questions. I'll be waiting for it. And do not forget to subscribe, like, and share so others could benefit. Till next time, bye. And know that Dr. Ayo truly cares about your health. Bye.